Hi, everybody. Dr. Ed Park. I'd like to review what I learned at A4M Peds. I think it'll be interesting to a lot of us. And let's get into it. Why was I there? I was probably one of only 3 or 4 non-pediatricians in a group of 100 people. Well, I was there because in February, I was giving a lecture on exosomes at Mark Hyman's Integrative Healthcare Symposium. And in the audience was this Dr. Elisa Song, and she's the organizer of our conference 2 weeks ago. I happened to meet her sister, her twin sister. In the interim, I've been able to help her with her torn meniscus, but that's Erica with a C, and Elisa is the pediatrician who is an integrative specialist, homeopathic doctor, and also a medical doctor. So I went to her conference so I could learn because over the years, there have been a lot of different things that people have brought to me, and I'm trying to make sense of what is gut dysbiosis, why does fecal transplantation work? Why is autism often helped with exosomes, but sometimes worsened? What's PANS PANDA? What is mast cell activation and the connection with infections, leaky gut, autoimmunity? So all this I hope to learn, and I wasn't disappointed. I liked Elisa Song's presentation. She was having a lot of fun. She was giving out these poop emoji things to her audience, very engaging. And she put together a panel of about 20-something lectures that were all very, very good and very informative. So let's talk about diseases that are complicated. And this is where the idea of functional medicine comes in. So when we look at the fact that 40% of children have a chronic disease, why should there be chronic disease in children? Something is not right. So some people point to the vaccine schedule. They've just been added on in contrast to many countries where there's a risk-benefit analysis. Other people point to our diet, which is highly inflammogenic. You can look at there are 9 companies that produce the majority of our food supply, especially the processed ones. And there has been a consolidation in the food supply, selling regular organic farmers to the corporations. Gut dysbiosis ensues. Also, the devices that we're addicted to create dopamine dependence and reduced resilience and social skills, increased mood problems. So autism spectrum diseases can be caused by many things, and that is the leitmotif here. The picture is a man with a hammer. Everything looks like a nail, but it's not working. And so traditional allopathic medicine, we know, treats the symptoms. You have allergy, sinusitis, you take an antihistamine or a steroid. Otitis, you have antibiotics or plug or tubes in your ears. Asthma, reflux, constipation, irritable bowel, obesity, diabetes, eczema, anxiety, depression, suicidality, ADHD, autism, PANS, PANDA, and antibiotic resistance, all problems with our children. So one term that came up quite a bit was the bifido species. There are many bifidobacteria, but they are gram-positive bacteria in our gut or large intestine. And newborns have a domination. They said 40 years ago it was 100% bifido. Nowadays it's about 80%. These are bacteria that like to feast on the milk polysaccharides. So breast milking and bifido equals a healthy biome. As we get older, we lose bifido in our guts. So it could be from 10 to 40% of the bacteria. And when they're very old, it's less than 5%. So what is the correlation versus the causation there? In terms of low bifido, we see it in immune-compromised states such as Lyme disease, cancer, and autoimmunity. Treatments can help with vitamin C and fecal transplantation. I've heard more than once patients of mine say, oh, I got a fecal transplantation and my symptoms got so much better, no matter what the disease. Adults, we require a higher diversity of our gut biome, but it's said that in the ages of 6 to 12 months, infants have and may need a leakier gut so they can get a low dose exposure to even enterotoxic bacteria and other pathogens so they can develop their immune repertoire. Also interesting, infants in this age range have a more permeable blood-brain barrier, which can lead to neuroinflammation. For more on this, see the work of Sabine Hassan and Taylor Soderberg, who is the chief medical officer of a gut biome testing or poop testing company. And if you look up these people, they're all mentioned in the title of each slide. So everyone seems to think gut dysbiosis is a huge factor. In fact, Dr. Song's bestseller, Healthy Kids, Happy Kids, goes very deeply into this. So what is dysbiosis? Well, for an infant from 0 to 12, it would be a lack of bifidobacteria caused by, for example, antibiotic use, but also, maybe some things in the diet or even in the environment. To learn more about this, see the work of Houseman Cohen, Sharon Houseman Cohen, Michelle Pero, Pejman Katarai, and Amy Durskin. So one thing we hear about is glyphosites. You see above here, glyphosites are a pesticide. It was originally developed as an antibiotic, and it preferentially kills the good bacteria like the bifido, but it lets the bad bacteria, staph, enterococcus, and clostridium survive. So that's no bueno. Dr. Houseman Cohen, who asked me to give lecture at her conference of Intelligence DNA, they have many single nucleotide polymorphism testing for personal genomics. And one of the HLA types, DQ 2.5, shows exuberant gluten immune response, and that's a 7x risk for gluten sensitivity if you have that gene polymorphism. It's well known now that gliadin, part of gluten in the wheat products and other products, releases zonulin, which can increase the gut permeability, the tight junctions between the mucosal cells. Glyphosate also directly does that, and indirectly through altering the gut flora. And finally, mold, which is ubiquitous in our food, can also lead to leaky gut. One of the more interesting lectures was by Jill Krista, naturopathic doctor, and it reminds us that the term quack is a modern term to suggest someone who is incompetent. But if we see above, this unknown painter around the same era copied a famous painting called Der Quacksalver, and it shows a quacksalver is Dutch for a person's salver is cellar, and quack is a potion. These potions, these tinctures, this is a form of natural remedy that people have been using and is not, on the face of it, illegitimate just because Rockefeller and the medical establishment says so. In fact, many of our greatest hits in pharmacology have been derived from plants. So Dr. Krista talks about nettles, which is Urtica dioica. She boils the nettles and they cause a Shrek green lemonade. And this will prevent atopy or mast cell degranulation in kids. Perilla leaves, which is something that Koreans love to eat. I declined eating it last night, but they're these pretty little leaves. They have antifungal and effects, and they blunt IgE degranulation. So perilla leaves are a good one. The Oregon grape is a powerful antimicrobial, antiparasitic, so it's helpful with kids with PANS. Thyme is a broad spectrum antibacterial, antiviral, and antifungal. The olive leaf is a broad spectrum antiviral and antibacterial, and essential oils like lavender can help calm the system. So there is a prominent bias towards using naturopathic remedies in this audience and these speakers. There might be a hidden bias against in the general medical community. Supplements are a broad topic. James Greenblatt and Amy Dirksen talked about them. Greenblatt had a very interesting lecture talking about suicidality. He correlated it with low cholesterol, vitamin D levels that were low lithium, and DHA or omega-3. If we look at this map above us, the area that was just ravaged by a hurricane is rich in lithium. So people in the drinking water supply get a lot of lithium, the suicidality rates are lower. When I asked, should I be adding minerals back to my reverse osmosis filtered water? He said yes, and I have been, and I feel better actually. So I think those things are probably too efficient in extracting everything from the water. General supplements that multiple speakers liked were vitamin D, but always do K2 also. My good friend Tamara, who passed away, showed me that the K2 potentiates the D for osteoporosis, immunity, regulation, and without it, the D alone could cause pathologic calcifications and even osteoporosis. Vitamin A, remember that's a fat-soluble vitamin, so that can be overdosed. But omega-3, also known as DHA, also greatest hit, quercetin. Some people need binders if they have toxins, and glutathione, which we do sell at my website topically. So a lot of people, I'm not sure about mitochondrial function. I've seen it in real life, people with tendinosis. I had a gentleman fly to me from Germany, couldn't walk 5,000 steps at 24 years old. All his mitochondria died from being exposed to the floxin, ciprofloxacin. But these are signs of low function, low B12, red blood cell folate, blood urea nitrogen, cysteine, organic acids, low CoQ10, high ammonia, elevated AST to ALT, which is liver functions, and a low carnitine. So they recommend supplementing B12, folate, and carnitine to help with that. Those were some of the greatest hits. But I think also I couldn't really take the time to mention all the other herbs, and they're very like the Ayurvedic herbs. Ashwagandha is very adaptogenic and immune regulating. But the good NDs will tell you that there are side effects from these too, and they may not be appropriate for everyone in every case. Moving on to diets, also a very important modulator when people are managing kids with complex, well, neurologic, but also, immunologic problems. And Julie Matthews and Elisa Song touched on this quite a bit. I love Julie Matthews' slide above. It shows that in autism, ADHD, anxiety, depression, learning disorders, and even Down syndrome, we have an interplay of all 6 of these axes, meaning your immune function, your oxidative stress, inflammation, which is triggered potentially by abnormal gut dysbiosis, poor detoxification, both of microbial toxins and heavy metals and mold. We have mitochondrial dysfunction, which can ensue, endocrine disruptors from the toxins, and also our biochemistry. Our single nucleotide polymorphisms can make it so that certain detoxification pathways are less efficient, and those largely depend on methylation, transsulfuration, sulfation. These methyl tetrahydrofolate reductase deficient people are particularly susceptible. So what do? Well, we remove inflammation. We try to dampen it and remove the immune response where appropriate. We correct deficiencies. We protect the gut biome. We try and limit the shotgun use of antibiotics. And the diets can be very important. She did a great presentation comparing 9 different diets in autism spectrum. And the current thinking is low sugar, of course, the high fructose corn syrup. They say kids get the equivalent of 17 teaspoons of sugar a day from all these sugary drinks and the processed foods and whatnot. So you want to decrease the casein, the milk protein in a lot of kids, the soy, the gluten, the corn, and the Feingold diet is one that worked particularly well. Low diets, low preservatives, and low salicylates. They found that a paleo diet was good for tics, self-injury, and OCD. Ketogenic diet was good across the board as long as you supplement with medium-chain triglycerides. And Dr. Song reminded us that the plastics that our drinks are in have BPA or bisphenol A, and also they have microplastics getting into our brains and our gonads. The parabens are the packaging plastics, which are hormone disruptors. And my friend Edwin Lee talks a lot about that. You can look him up. And the phthalates are plasticizers, which make things, rubbery in food and all kinds of things. And those are also immune disruptors. I think the nomenclature is a little hard to get, but I'm going to break it down for you. PANS, PANDAS, they sound the same. Are they the same? No. So PANDAS is pediatric autoimmune neuropsych disorder associated with strep. But that is a subset of PANS, which is pediatric acute onset neuropsych syndrome. For more on this, you can read the books of Scott Antoine and Nancy O'Hara, who both lectured at this wonderful conference. If you ask regular pediatricians, half of them don't even believe in PANS, PANDAS. So that's a controversial hurdle right there. The main hallmarks of the disease or syndrome of PANS is its acute onset. You can have a normal kid, and if they get the exposure or the problem, then the symptoms are dramatic and intense and sudden. They consist of separation anxiety, social school anxiety. They have little fits or tics or panic attacks with any kind of change of scenery or movement, or transitions. And it can involve obsessive compulsive disease, rituals, and intrusive, often shameful thinking. So, what is that? Again, we're not really sure about there's no exclusive test you can do. There's a lot of empiric sort of things you can find out if it well, we have positive strep throat and high anti-streptolysin titers, and the kid has these behaviors, then we might be dealing with PANS panda. But again, it's not that simple, and it requires more thinking on my part to even understand it. But again, we see this beautiful diagram from Dr. O'Hara saying, what is autoimmune disease? It is an imbalance somehow between the tolerance and the immune response, which leads to all these problems. So we have increased gut permeability, which causes an immune response, which alters the microbiome, perhaps. We have our own single nucleotide polymorphisms, or genetic failures to maintain metabolic pathways, vitamin pathways, antioxidation pathways, or have different immune responses, for example, to gluten. We have environmental factors like the plasticizers, and we have clinical outcomes. This is the final thing, but it's a very complex set of multifactorial problems that contribute to us. So just wrapping up, I want to say that nobody understands anything. The man who brought us, petroleum transportation and killed the electric grid was John D. Rockefeller, but he kept a homeopathic doctor for his whole life, was a believer in naturopathy as well. And he was quoted as saying, homeopathy is a progressive and aggressive step in medicine, whereas the entire field of medical education, training, certification has been dominated by the so-called allopathic medical establishment, which is largely, great in terms of acute things, problem solving, randomized controlled trials, and single molecule things for infections. But unfortunately, any doctor worth their salt will tell you that most disease is chronic and probably functional in nature, meaning your mindset, your environment, your immune system is generating this. But nevertheless, we are in the church of allopathy. And it's just funny to hear Dr. Song had to fill in for somebody who was very sick and hospitalized with COVID. So she gave a canned lecture on homeopathy, which really kind of blew my mind. Because if you think you don't understand immune dysfunction, autoimmunity, join the club. I mean, I joke, but it's not a joke. My book has a whole chapter on the immune system, and I don't really understand what I wrote, even though I kind of do and did at the time. But it's very, very complicated. And so Dr. Peter Fisher, who's a proponent of homeopathy, says, the reason why people find it so challenging to understand is we think about pharmacology in molecular terms. If you take homeopathic medicine, a pharmacologist would say it's water and ethanol and sugar, and that's true. So the very notion, homeopathy is like a punchline to us real doctors. But then he makes the point of an analogy. If you take a floppy disk to a chemist, he'll say it's ferric oxide and vinyl. The information in the disk is of no importance to him. So he's saying we shouldn't write it off because we don't understand it, and the dose response relationship is inverse. I don't understand it. I love the lecture and I'd like to learn more, but the principle is just that like cures like. So you have certain symptoms, you give a little hair of the dog, and somehow that modulates your response. All right. Some of the great things that we're reminded of is not just disease, because you get so confused. Dr. Song said, well, breast is best. We all know that for the brain development, for the immunity, but then also the mother dumps a bunch of toxins in the breast milk. So you sometimes get a little confused and a little guilty. And I'm sure doctors that are part and parcel of administering a lot of the vaccines, which may be implicated, are ambivalent as well. But I like and respect their creativity in trying to find solutions. And a lot of what I resonate with is these people that train you how to be human, how to be healthy. And health is what? Resilience. So the opening lecture was a grandfather of functional pediatrics. His name was Bill Sears. And he just kept on hitting the theme of humans need to be human. They need to go outside. Kids need to play. They need to be in nature. They need to dance and sing.
And so I think that's an important reminder. This is from his presentation. I feel peaceful. I feel peaceful. So peaceful. So peaceful I feel. My brain comes alive in the scenes of nature. And I think it's important to remember that we are not transhuman yet. I have a dear patient of mine. I asked her about her brother. He said, "Oh, he moved back to Ecuador. You know, the kids weren't growing up right. And what did he find out as a side effect of moving back to Ecuador? Well, they didn't have good cell service, so they weren't on TikTok all the time. And these kids, like probably 8 and 10, all of a sudden they started talking. They were going outside, they were playing, they're interacting, they're smiling, they're happy. So we have to be very cognizant of that as well. Navaz Habib talked a lot about the vagal system, and it's obviously implicated in relaxation. So when we sleep, we're restoring. If we learn how to breathe correctly from the diaphragm, that's relaxing to the vagus system. And that's reflected immediately in heart rate variability. 3 weeks ago, I had a friend of mine, a doctor, I treated her for a traumatic brain injury, and her heart rate variability shot up from 300 to 800 overnight with a small dose. One could say almost a homeopathic dose. Also, the vagal nerve is in charge of regulating the spleen, and the spleen is what tells us our immune and inflammatory status. So the vagus gets us to calm down. Scott Antoine talked about cell danger response, but he also talked about hacks you can do to self-hypnotize, neuro-linguistic programming, sort of speech hacks to emphasize the patient's freedom and their safety and their ultimate good health. And I thought that was clever. Finally, Piper Gibson, who told the story of her own son, who developed a pretty severe facial tic. She was an expert in tic disorders. And I think her message also was that when they started training the kids to do self-regulation, breathing, get through their tasks, limit their obsessive behaviors, they actually excelled in other areas. They became star athletes. So what is implicated in tic disorder? She explained it as a pot that's just boiling over. People have these tics, and of course, Tourette's is an extreme form of that because their emotions are overwhelmed. And this can be contributed to, again, by leaky gut, stool pathogens, food sensitivities, organic acids, which we didn't really talk about, heavy metals, and mycotoxins. So I want to remind people of our favorite patient, or at least the patient who had the biggest effect. Above me, a Hungarian man with irritable bowel disease, diarrhea after every fast food meal, eczema, swelling on the face, varicose veins. He photo documented, as you can see on my website, if you look at varicose veins, www.rechargebiomedical.com. In 2 weeks, the puffiness went away, the eczema went away, and the veins went away. So really, this is the moment in time where I, even having interviewed David Perlmutter, the Grain Brain guy, I was like, is this really a thing? Do people really need gluten-free foods? This is the point I really understood. Yeah, the gut can be leaky and it can cause mast cell activation. The food particles in your bloodstream are a disaster. And this seems to be part and parcel of what's going on with a lot of these kids. So the argument for exosomes for kids would be the increase in vagal tone that we just mentioned, healing a leaky gut like this Hungarian fellow. But we know from multiple studies that what these exosomes do is shift the M1 or activated or inflammatory macrophages to M2 or calming regenerative. Also, you can read about in my book that the T cell differentiation or behavior goes into T2, Th2, Th17, Treg. These are all flavors of how your immune system can be acting, and these are more inflammatory or anti-inflammatory rather. So, I do have one of the providers in my course treats about 30 autistic kids, including her own son, who she's measured very, very significant results, improvements. And she claims she's getting really good anecdotal improvement in the autistic kids. I just had another provider of mine who got a kid to start initiating speech last week just by doing nasal inhaled exosomes. So if you want to learn more about this, go to rechargebiomedical.com or my YouTube channel, DRPRK65, and certainly pick up a book, which is Exosomes, Songs of Healing, also an audiobook and ebook. And this will clearly explain to you how exosomes could play a role, not only in autism, but in general health and wellness. So Dr. Ed Park, signing off. Please sign up for my newsletter if you'd like to receive more of this content, and like and subscribe as well. Thank you.